Spirochetes. Here's a basic overview for spirochetes. So for morphology, they are long, slender, gram-negative, helically shaped bacteria. They possess axial filaments located between the cell wall and outer sheath. For motility, they have a rotation of axial filaments that produces a corkscrew-like motion. Movement occurs in opposite directions, enabling the spirochete to move through viscous environments. So treponema is important in humans. It is a slender and tightly coiled spirochete and includes species that are actually responsible for syphilis. Then we have Borrelia, which is thicker and loosely coiled spirochetes, which includes species causing Lyme disease and relapsing fever. Spirochetes are not easily seen by gram stain due to their thinness. So we can visualize these using dark field microscopy, immunofluorescent microscopy, or even electron microscopy. So for dark field microscopy, this uses scattered light to visualize very thin, transparent organisms like spirochetes that are difficult to see with standard bright field microscopy. Some advantages is this allows direct observation of live motile spirochetes. It's useful for rapid diagnosis of syphilis by examining lesion exudates or body fluids. Some limitations is it requires a fresh specimen, and background debris can actually interfere with interpretation. For immunofluorescent microscopy, so the principle is it uses fluorescently labeled antibodies that specifically bind to treponema or Borrelia antigens. Some advantages is it provides specific and sensitive detection of spirochetes and can be used on fixed specimens or smears. For limitations, it requires availability of specific antibodies and specialized equipment. For electron microscopy, its principle is it uses a beam of electrons for ultra-high magnification and resolution. Advantages is it visualizes detailed ultrastructure of spirochetes, including axial filaments and cell envelope layers. It's helpful for research and confirmation of spirochete morphology. Limitations, though, it's not routinely used for clinical diagnosis due to its expense and its time consuming. For habitat for spirochetes, so many spirochetes are free-living saprophytes, which means they are found in contaminated water, sewage, soil, and decaying organic matter. For treponema species that infect humans, they commonly inhabit the oral cavity, gastrointestinal tract, and the genital tract. For transmission, treponema pallidum, which causes syphilis, is transmitted primarily by direct sexual contact. It can also be transmitted transplacentally from the mother to the fetus. Borrelia species can cause Lyme disease and relapsing fever, and these are transmitted by arthropod vectors such as ticks and lice. Treponema pallidum causes syphilis. There's a venereal type, which means it's acquired, or a congenital, which means it's passed from the mom to the baby. Most often it is spread from sexual contact, but transplantal transfer can occur. Treponema pallidum has stages of infection. So the primary stage will result in some chancres. This is the site of the spirochete multiplication. Typically, we are using serologic testing for treponema, and this is not something that would usually grow on a culture. So that is why serologic testing is used. And then especially women, they can be asymptomatic as well. So they may not even know that they have it. So serologic testing would be able to show that they do have it or don't. So the secondary stage happens when they have not treated the primary stage, and then that is when it moves into the secondary stage. So we can get a molecular papular rash. Again, your serology should be positive. There then is a latent stage where testing will still be positive, and then it turns into the tertiary stage if the patients have still not received treatment. And then this may actually develop into neurosyphilis. You can do a direct exam for motile spirochetes by a direct field microscope or a direct fluorescent antibody test. You're going to have the specimen from an area of infection. However, normally the testing for syphilis is serologic testing, and those are divided into what we call non-treponemal and treponemal testing. So for treponemal and non-treponemal testing, these are both used to diagnose syphilis, but they measure different things and serve different purposes in the testing process. So the non-treponemal, these are going to detect antibodies that are produced in response to the damage that's caused by the treponema pallidum. Treponemal testing is used to detect antibodies that target treponema. So this is going to be a more specific test, and they will use this as a confirmatory test. Okay, so a non-treponemal test is an RPR or a VDRL. Hopefully this is a review. So this is a screening test, and there are several items that will cross-react with conditions like lupus or pregnancy. So you can get false positives on this. So the definitive test, which is what we call that treponemal test, is an FTA-ABS, which is a fluorescent antibody absorption. This is a direct detection of antibodies specifically produced to the spirochetes. Positives with RPR and VDRLs are almost always confirmed with the VTA-ABS again. The RPR and VDRL is a non-treponemal, where the FTA-ABS is a treponemal syphilis. Syphilis can be treated with penicillin, and they're starting to see some resistance with that, so they might start to treat with doxycycline as well. And then we move to Borrelia burgdorferi, which causes Lyme disease through a tick as the vector. This is endemic into areas of the United States in the Northeast and the Midwest. Borrelia recurrentis, causes relapsing fever. Lyme disease begins with a tick bite symptom, which will include headache, fatigues, chill, fever, joint pain, swollen lymph nodes, sometimes a skin rash called erythema, migraines, and then sometimes they also have that bullseye appearance where the tick bit them, as you can see in the picture. Lyme disease can be difficult to diagnose. It's usually more of a rule out kind of thing, especially if the patient doesn't know they've been bitten by a tick. Borrelia species are identical, so therefore you can't really distinguish between them by microscopy. So Borrelia can be seen on a Gamsa or a Wright stain on a thick or a thin smear. And we'll talk more about thick and thin smears once we get to parasitology. So serology is usually your diagnostic standard for Lyme disease. And Lyme disease can be treated with tetracycline or erythromycin.